We're going to talk a little further about heroin addiction, as I mentioned before the commercial break. And with me today, special guest Dr. Gary Jadagi, also known as Dr. G. Dr. G, welcome, sir.
Thank you very much. Hello, and thank you for listening.
Let me restate your name, Dr. Gary Jadagi. I did mess it up the first time.
Yes,
Sorry about that.
No problem.
So Dr. G, he is an expert in addiction, and we're going to talk a little bit about heroin.
Yes.
This is a humongous problem here in America, and as I was saying earlier, to the disgrace of many, Mexican drug lord actually boasted about being one of the main distributors of heroin.
Yes.
So what is heroin, Dr. G?
That tells you the depth of addiction to the point where he is boasting.
Isn't it terrible?
Isn't that terrible? That's crazy.
Yeah.
So heroin is an opiate, if you will. There are different categories. We have covered that at times, on Therapy Cable, but heroin is more or less a synthetic product that has been created from morphine, right? And morphine comes really from opium, from poppy seeds. So it's naturally available, but then when they take it and synthesize it and basically create a product that can be used more or less in a medical capacity, heroin or morphine, it's different versions, and also in pill version, if you will, like Vicodin, OxyContin, and so forth. These are variations of that same opiate category. They are really analgesic.
That's a pain reliever?
Pain reliever, narcotic, sleep-inducing product, as well as, I would say, depressant, because a lot of times, what it does is depresses the functionalities of organs, especially, let's say, what we get a lot of times with heroin overdose is that the lungs just stop functioning, right? And
that's not a very good thing.
That's not a good thing, and in fact, as a result, you get no oxygen to the brain. Due to that kind of a hypoxia, you get brain damage, and in fact, when you're not breathing, you die, right?
Sure.
So now it's usually in its medical use as morphine, if you will, or OxyContin, etc. Or Vicodin. They're used in a fashion to help people to reduce their pain. Let's say after surgery, after an accident, or maybe some kind of a bodily physical ailment that is, fraught with pain. So it's pain reduction strategy, right? But
it's also highly addictive, correct?
It's highly addictive, and part of the reason for that is that, first of all, it easily enters the blood vascular system. It gets into the brain. The opiate receptors of the brain immediately respond to increased dopamine levels due to heroin use or morphine or opiate use. And what it does is really does a few things. Number one is that it has a certain main effect, which is that euphoria. When people, let's say, snort or smoke or especially inject heroin, they get that sense of kind of relief, peacefulness, especially with injection, right? With snorting and inhaling, it's going to take some time. Smoking, it's going to take some time because it has to go through the lungs and through the blood system to get to the brain. But when you inject heroin, then it immediately is in the brain or vascular system and gets to the brain cells and has that immediate effect of this body-wide peacefulness, right? All your body can imagine you have absolutely no pain and a lot of sensation of pleasure.
That's tempting.
Combined at the same time. It's a huge rush that people get, right? Mm-hmm. Now, that's temporary, if you will, but then with it comes a sense of that relaxed state, a little bit of a heaviness in the extremities and flushing, as well as just simply almost as if all your worries have dissipated, they're gone.
And how long does that last?
Well, it lasts certainly the rush lasts really for minutes, not really too long, but then after that, the sense of peacefulness lasts for a few hours, if not longer. So especially depends on if there's a first use or a prolonged use or a chronic use. It can last for a few days and until the person is again kind of starting to feel the craving, because every substance sooner or later has to be flushed out of the system, because our metabolism really is in charge of that. The pharmacokinetic principles of the body that basically move or metabolize and flush the substances out of their system through liver or kidney. That's just a natural phenomenon. So when the system leaves our when the substance leaves our system and our body, then we start craving. And part of the reason we start craving is because those neuroreceptors have been kind of programmed to receive more of this substance, and our natural system internally that usually is in charge of releasing endorphins naturally, including dopamine, has kind of shut down, because once our internal organic system senses that there's external help, injection or intake of substances, then it shuts down, because otherwise we would have overdose anyway, right?
Sure.
If we're internally producing endorphins, externally taking them, it would easily lead to death, to overdose or overflow of all these neurotransmitters.
Your body's natural production shuts down.
Right.
We do have a question. We have a couple minutes left. We have a question from a guest, Jack from New York. He said he has a brother who was a heroin addict, actually still is a heroin addict, and he wants to know what forms of treatment might be helpful.
Well, the best form of treatment for heroin addicts is really a combination of both a medical, I would say, pharmacological treatment, which includes taking some substitute medication in order to reduce the craving. Then there are a few of them. Plus is psychological and addiction-oriented treatment that taps into the behavioral aspect of the addiction. So both medical and behavioral. The reason a medical, tapering down, if you will, is necessary is that our body, especially with the heroin users, they have very intense high levels of craving. That even when they are in a, let's say, treatment center and getting the psychological treatment that they need, they may sabotage that type of a treatment and get out early, use all kinds of manipulative techniques to end and get discharged, or even use while they're in treatment because of the physical craving, right?
Oh, wow.
So in order to tamper or basically taper down that physical craving, what we do is we use the medical pharmacological help, and that can include something like Suboxone. Also methadone is one of the prevalent ones, but methadone is not really recommended anymore, even though it is in high demand, because it can by itself lead to very addictive dependence, prolonged use of methadone. So better than that would be Suboxone or naltrexone, and there are some combination of Suboxone and naltrexone out there in the market known as withdrawal or Bonneville, or even some implants that people do in their body that last for 6 months to a year to deal with the physical cravings.
We got about 1 minute. Does it help? The support system is important? Family, friends, is that a really important factor? Huge factor, definitely, but not without these other factors.
Okay.
It's like a three-pronged approach, I would say. One is the medical. Second is the individual treatment,
which is
right?
the therapy?
Psychological, the therapy,
Okay.
the treatment center or rehab center methodology.
Okay.
And the third, environmental, family, social.
Environmental.
Right.
Perfect. There you go, folks. Dr. G, he knows his addictions. Thank you so much, Dr.
Right.
G, for being here on the
You're
Therapy
welcome.
Cable Live. We talked about addiction. We're going to have to bring you back to get more information about this. We can learn more. We barely covered the tip of the iceberg here.
We did. Any other questions, please let me know.
Absolutely. Thank you
Thank
very
you for
much,
having me
everyone.
here.